Next question is, if I have a C-section, will I get skin to skin in the operating room if both my health and baby health are okay?
Yeah, so we always endeavor to try to do skin to skin in the operating room because we know how important that first hour is. So sometimes it's a little bit tricky. Sometimes we're more so able to do skin to skin holding baby up around the chest and neck area.
Yep.
Sometimes we are able to put baby fully on the chest.
Yep.
If the baby is really eager and a little bit of an overachiever, sometimes they will latch right on the operating room table, which is always lovely. We love when that happens. Sometimes because of the nature of the medications and the surgery, sometimes the parent isn't really feeling great.
Right.
And so if that's the case and skin to skin isn't necessarily the best option in that moment, then we would recommend the partner or the support person hold baby really close to the parent so they can still smell and be close to baby.
Yeah.
Otherwise, if we're unable to, for whatever reason, do skin to skin in the operating room, we always will encourage that first 1 to 2 hours of skin to skin in the recovery room.
Right. Right.
So if for whatever reason the parent has to go to sleep during the surgery and they are no longer awake for the end of the surgery, that means they would have to go to the recovery room.
Right.
If that happens, we would always bring baby over to the recovery room. So as soon as they're awake and alert and able to do skin to skin, that we'll be able to do that.
Baby's right there.
In the meantime, if there is some separation between the birthing parent and the baby, we would encourage, say, the partner to do skin to skin in the room until we're able to bring the baby and the birthing parent together.
Right. So basically, yes, they will always be able to, however it pans
out. It works out, but yes, that is a definite standard of care around here.
Awesome. Awesome. Okay. The next question is, will I stay in the same room after delivery or do I get moved to a different room?
Yeah, so our goal is for you to essentially labor, birth, and then be discharged from one of these rooms.
Right.
However, we only have 5 labor rooms, and our community is growing and our number of deliveries is growing. I feel like every single year we're getting more and more deliveries. So unfortunately, we probably will have to move out to a labor room or out of a labor room.
Right.
However, we do have plenty of private rooms. So our families will go from a private labor room to a private postpartum room.
Okay.
We do have one semi-private room that very, very rarely gets used for postpartum families. And I'm talking, it has to be crazy busy for that to happen. Otherwise, we do have post-op gynae patients that would use those beds. So I'd say 99% of the time, it's a private room.
Right, right. Awesome. Okay. The next question is, can my support person stay overnight with me?
Yes, please. Please stay over.
Yes.
Please be helpful.
Yes, that's what they're here for.
Don't just sleep on that bench.
Yes.
Be helpful. Be a support person. Yes.
Yes.
Please.
Birthing parents
one person
need to...
we encourage one person to stay over. We only have one sleeping surface for one person.
Right.
So whoever you're choosing to have as your support person stay over with you, just make sure they're helpful.
They're aware of what their expectations
what the expectation is. So they're there to help you. They're there to help baby.
Right.
But yes, please have someone stay over with you.
And bring snacks.
And bring snacks. Yes.
Okay. The next question is, when and what does discharge look like? Do I have to stay 24 hours after baby is born? And what if I have a C-section?
Sure. So you don't have to stay 24 hours. Some families, especially families with other children at home, will choose to go home less than the 24-hour mark.
Right.
As long as everybody is safe and stable.
Yep.
Sometimes we do delay a discharge because of risk factors for like hypoglycemia or low blood sugar.
Okay.
Or needing to repeat blood work for jaundice, so bilirubin level, or if we're worried that that baby has a higher risk of infection. So we might say, we really do want you to stay longer than, or stay at least the 24 hours.
Yep.
Sometimes up to 36 hours.
Okay.
But absolutely under 24-hour discharge is an option if everything is stable.
Yep.
It just would mean that you would have to bring the baby back for the newborn screening testing. So a lot of families will choose to just stay the 24 hours, get all that newborn screening testing done, and then they can go home.
Right.
For a C-section, probably you'd be looking at more like 36 to 48 hours for discharge.
Yep.
But I have had some repeat C-section families go home after 24 hours if everything is good and they're feeling good. But I would plan for 24-ish hours.
Right. Right. Awesome. Okay. And the next question is does Woodstock General Hospital have a NICU unit? If not, what happens if baby needs that?
So we do not have a NICU or special care nursery at this time. Hopefully in the future down the line, that will be something that our community will be able to have in place so that we're not separating our families.
Yeah.
So we have a very skilled medical and nursing staff that would stabilize the baby.
Okay.
And then if they required higher levels of care that we're requiring, say IV antibiotics, IV sugar to maintain normal blood sugar, or if they're requiring breathing support beyond sort of initial transition, then the babies would be transferred to a hospital in the region. So most commonly we transfer our babies to London, Stratford, St. Thomas, and Grand River, I'd say would be like the most common ones.
Okay.
And then if that were to happen, we would either try to get the birthing parent a bed at that facility, or worst case, we would discharge them early so that they could go and be with their baby. Yeah.
Right. Okay. So at the first initial, once baby leaves, birthing parent would either have to get a bed to get there or discharge and get there. They're not leaving together.
No. Very rarely can we coordinate that quickly, but
for the baby's best
interest, they need to be where they can get the care that they need.
Absolutely.
So sometimes there is some separation there.
Yeah.
If that happens, or we anticipate that the baby is going to need to be transferred, we would talk to the family about, can we get you hand expressing? Can we send some colostrum with the baby?
Yeah.
If they had maybe harvested some in their pregnancy, we would send that with them also. But we would definitely get the breast stimulated and encourage them to send some colostrum off with the baby wherever they go.
For sure.
And then we would work with them to help pump to start to initiate the milk supply until they can get to be with their baby.
So they can be there.
Yeah.
Okay. Good question. Okay. The next question that came in is, I'm using a midwife. What does that look like at Woodstock Hospital?
Yeah, so we do work with the Thames Valley midwives. They come here quite frequently with their clients.
Okay.
So it wouldn't really look a whole lot different other than your care provider is your midwife, and so they would manage your labor. They would be your support for labor and delivery, and then they would also look after the baby in the postpartum period. And then as we know, midwife care goes beyond the hospital, which is lovely. So everything would pretty much be the same care wise. It's just that their care is going to be managed by their midwife instead of one of our staff nurses. Now, that being said, sometimes care needs to be transferred if things become more complicated or if the family requires a C-section. In that circumstance, the midwife would be responsible for the baby assessment and looking after the baby in that initial time period. And we help with the C-section component of delivery at that point. We help to assess the baby at transition to make sure that they're breathing well. And if the family requires, or if the birthing parent is interested in an epidural, then the nursing staff would get involved at that point to help assist with the epidural and monitor the epidural while it's in place.
Cool. And like you said, you guys work with them often, so you guys have a great relationship, and it's something that's something that is common.
Yes, absolutely. Yeah,
Awesome.
For sure.